Let's begin. Number 8. The myth that talking about it makes it worse. You've probably heard someone say, "Don't dwell on it. You're just making yourself more depressed by overthinking," as if your brain is a beehive that you shouldn't poke or the bees will attack. But here's the scientific plot twist. Suppressing emotions doesn't make them disappear. It just shoves them into a psychological pressure cooker until they explode sideways, usually as physical symptoms like headaches, insomnia, or that fun mystery stomach pain your doctor can't explain. Mental health professionals have been screaming for decades that verbalization is actually therapeutic. When you bottle everything up, your amygdala stays in panic mode, flooding your system with cortisol. So no, discussing your anxiety isn't making it worse. It's literally the biological off switch your brain desperately needs. Number 7. The dangerous idea that mental illness is just weakness. Some people treat depression like it's a character flaw, as if sad people just need to toughen up and drink more green smoothies. Here's the reality check. Mental illness is a medical condition involving brain chemistry, neural pathways, and genetic factors. Telling someone with clinical depression to just think happy thoughts is like telling a diabetic to wish their pancreas back to health. Your brain is an organ, and sometimes organs malfunction. Depression, anxiety, bipolar disorder, these aren't moral failures. They're neurological conditions that require actual treatment. Stop treating your brain like it's exempt from basic biology. Number 6. The myth that medication is the easy way out. Oh, you're on antidepressants? Some people look at you like you just admitted to cheating at life. But here's what those people conveniently ignore. Psychiatric medication isn't a magic happiness button. It's a tool that corrects malfunctioning brain chemistry. Nobody tells a heart patient that beta blockers are cheating. Nobody shames a diabetic for taking insulin. But mention SSRIs and suddenly everyone's a philosopher debating the authenticity of your healing journey. If you need medication to function, take it. Your brain doesn't care about society's opinions on pharmaceutical authenticity. Number 5. The belief that mental health issues are rare. People love to think mental illness is some exotic condition that only happens to other people, but statistics obliterate this fantasy. Nearly 1 in 5 adults experiences mental illness in a given year. Anxiety disorders alone affect 40 million American adults. This isn't fringe stuff. It's a global epidemic hiding in plain sight because everyone's pretending they're fine. The stigma keeps people silent, which creates this illusion that mental health struggles are uncommon. Normalizing this reality doesn't make it worse. It makes people feel less alone and more likely to seek help. Number 4. The idea that you can just snap out of it. Just choose to be happy. Just stop worrying. As if your limbic system responds to motivational posters like a well-trained dog. Here's the neurological truth. Mental illnesses involve dysfunctional brain circuits that don't respond to willpower alone. You can't just decide to reboot your serotonin levels. Anxiety isn't a light switch you flip off when it's inconvenient. Telling someone to snap out of it is like telling someone with a broken leg to just walk it off. Recovery requires therapy, sometimes medication, lifestyle changes, support systems, and time. Your brain didn't break overnight, and it won't heal with a pep talk. Number 3. Thinking therapy is only for crazy people. There's this bizarre notion that seeing a therapist means you've completely lost it, as if therapy is the last stop before they lock you in a padded room. But therapy isn't for broken people. It's for humans navigating life's garbage disposal of stress, trauma, and existential dread. You don't wait until your car explodes to get an oil change. Therapy is preventative maintenance for your mental health. It gives you tools to process emotions, break toxic patterns, and understand why you sabotage relationships or panic in grocery stores. Normalizing therapy means fewer people hit rock bottom before asking for help. Number 2. Believing you should handle everything alone. Society loves the rugged individualist who white knuckles through mental breakdowns without burdening anyone. But humans are wired for connection. Isolation during mental health struggles amplifies the problem. Your brain literally releases bonding hormones when you share vulnerability with trusted people. Asking for help isn't weakness, it's survival. You wouldn't perform surgery on yourself, so why treat your mental health crisis like a solo DIY project? Number 1. The lie that mental illness defines you. Getting diagnosed doesn't turn you into a walking disorder. You're not a depressive or an anxious person. You're a person experiencing depression or anxiety. This isn't semantics, it's crucial. Your condition is something you manage, not your entire identity. You have hobbies, relationships, dreams, and terrible taste in pizza toppings. Mental illness is one chapter, not the whole book. If this video destroyed some myths you've been carrying, hit that like button. Share this with someone who needs to hear it. Subscribe to Freakonomia for more truth bombs. Until next time, take care of your brain.